Kathy, have you ever almost died?
I mean, I've done burpees, so spiritually, yes.
Okay, well, today's guest actually almost died. Like hospital every day, specialist on speed dial, almost died. And here's the wild part. He's a chiropractor. Like no chiropractor has ever almost died before. So he's lying there totally at the mercy of nurses and doctors and techs. And he has this massive epiphany about what it actually feels like to be a patient. And spoiler alert, it's not all about outcomes. It's actually about whether your provider can find the vein on the first try.
Oh, that's where we're going today.
Yes, we're going there. Because if you think your patients care most about your technique or your fancy diploma on the wall, you might be dead wrong. Pun intended.
Okay, here we go. This is the pitch.
What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch. Uh-oh. Here we go. We're back. I'm welcome to the Pitch Podcast. I'm not welcome. This is the Pitch Podcast. I'm Dr. Jason Young.
And I'm Dr. Kathy Lynch.
Yes, and I want to introduce our guest today. This is Dr. Bobby Maybee.
Hello.
Yes, as mentioned, he is a chiropractor. And spoiler alert, he lived.
I did.
He lived.
Hey.
Yes.
Second spoiler alert. Doctors are awesome.
Yes. Very good. No, we're really glad to have Bobby. Bobby's been a friend of mine for a long time, a couple of decades, I would say.
Yeah.
Decades.
Very well respected in the profession by good people. And bad people don't respect him.
No.
So
Simple as that.
yeah, pretty much. Sometimes that's the whole scorecard, right? Is who respects you and who doesn't.
That's the truth.
Well, let me tell you a little bit about him. Bobby is, where are you from, Bobby? I should have asked
Originally
that.
from San Luis Obispo, California.
Oh, yes. Okay. Another
St. Louis,
California.
the Bishop de Tolosa, California.
No, okay. Very good. Yeah. I think that there's two types of Oregonians. There's native Oregonians, which are actually born here. And then there's what I call true Oregonians, which that's you and I. We're people from California who live here.
Well, Jason, there are native Oregonians, and there was a thing called the Oregon Trail.
Oh.
Yeah.
Everyone that comes after that.
Yeah, it was actually a video game.
Heard of that.
Well, let me tell you a little about Bobby. Like I said, he's a chiropractor. You're practicing up in Portland, yes?
Yes, sir.
And what's the name of your practice up there?
It's Bobby Maybee, DC.
Bobby Maybee,
right.
DC. What a crazy name for a practice.
Maybe a DC.
Yeah.
Original practice name was Wellness and Motion.
Mhm.
And before that, Middle Path Medicine, my partner was Gary Forsman, MD, integrative oncologist, by the way.
Oh, really?
Internal medicine specialist.
Wow.
No kidding.
Yes, we ran a integrative clinic.
Yeah,
Cool.
sweet. I love it. So he is also a basketball referee.
Let's
I am
go.
Yes.
official for high school, hopefully soon college, and wheelchair basketball.
All right,
Cool.
that's good.
Cool.
So, hey, maybe I could play basketball then.
One of these days.
Yeah, one of these days, yeah, I'll finally be able to block somebody. Okay, and you're a veteran.
Yes,
Thank you for
U.S.
your
Air
service.
Force. Yeah,
Okay.
All right. Oh, so you're smart. You joined the Air
the
Force.
chair force.
The
is
chair
other-
force, right?
Yeah.
You deployed mops and things like that.
Mhm.
I deployed equipment around the hospital and
Awesome.
files and charts. And,
Yeah.
Intense.
That's good. And let's see, practicing for 20 years. Actually, first met you when we were in chiropractic school.
That's right.
You were just finishing up as I was starting.
Yeah.
And so that was about all I remember. I like was just watching you walk away. So
Well, the whole thing's a blur, right?
it is.
How
yeah.
about PT
Mhm.
education is
Oh.
a blur as well?
Yes.
Yeah.
While I was in school, I felt like it was 10 years while in school.
Yeah.
And it was only 3.
Yeah, that's
Mhm.
I've been out for 10 years. I'm like, boy, this has gone by quickly.
Yeah, it's like the thing that I think about when I think about how overwhelming it is. I
Mhm.
remember when we got to Western States, Harvard of Chiropractic College.
that's
right
right.
here.
Yes. I couldn't work, so we had to go get food stamps. And my wife sent me.
Mm-hmm.
It's
Same
because she didn't
here,
want to
guy.
go get food
Yeah,
stamps.
no.
So I sat down and I was talking to the lady, and she's like, "So, yeah, why aren't you working?" I was like, "Oh, because I'm in school and I can't have a job and do school at the same time. She's like, well, you should. Like lots of people have a job and goes, I was like, no, I worked full time when I was doing undergrad, but like here I have like 30 credits. She's like, no, you can't have 30 credits because no school allows that. And I was like, well, I happen to have my schedule. This is my schedule. So she said, what you should do is you should drop out of school and support your family, sir. So yeah.
Hey,
That will be the
Plato
plan.
of the unemployment line.
Yes.
That was it. Yeah. And so, yeah, it's a blur because
Yeah.
it's pretty intense.
And
So,
I will apologize in advance because I have my own podcast. I might interview you guys. on
Oh,
that.
yes.
Love it.
Yes. And we want you to plug your podcast too.
The podcast, the Forward Thinking Chiropractic Alliance with Dr. Bobby Maybee.
Okay.
Nice.
Yeah.
Look
I know
at
that
On
guy.
Spotify and
I know that guy.
Ooh.
Sweet. We're gonna
iTunes and all those.
We're gonna link it in the show notes. It won't do you any good because nobody
No
goes to
one's
the show
listening.
notes. But on the outside chance, like
It's a two-way street. No one's listening there either.
yeah, sweet. We'll just listen to each other's podcasts
Yeah.
all day. We should actually cue it up and just play it right now in the background.
Get double plays.
Yeah. Oh gosh, I'm actually remembering. I've been on your podcast
You have,
before.
yeah.
Whoa.
That was a long
Good
time ago.
times.
Changed my life.
Yeah.
Yeah, apparently.
Kathy, you're
clearly.
next.
Okay.
Unfortunately, so.
Okay. I hear it's
Look for the email.
It's very
Yeah.
memorable. It sounds like.
Yeah, she has an NDA, so she can't.
Oh, okay.
No, just.
Makes
All right, we're working our way through your bio here. Okay, so chiropractor, referee, veteran, wife, 5 children.
Yes.
Okay, and probably one of the coolest things about you, one of the most unique things about you, is that you started a movement. It's not really an association; it is an organization, but more than anything, it's kind of a movement.
Okay.
I would call it.
Probably so, yeah.
Yeah,
Mhm.
the Forward Thinking Chiropractic Alliance.
It was a time and place thing, but it stuck. So
Yeah.
the Lindy effect is in effect. It's been around for more than a decade, so it's stuck.
Okay,
Impressive.
is that what the Lindy effect
The
is?
Lindy effect is the longer something sticks around, the more likely it's going to last.
All right, nice.
Okay.
Like
That's good.
furniture. You get a good piece of
Mhm.
furniture that hasn't broken in the first 2 years, it's
Mhm.
probably going to last you a fair
All
long
right.
Okay.
I like that.
Does not apply to old people.
No,
No.
the Lindy effect does not apply to biological species at all.
Okay, dang
Even
it.
chiropractic.
Yeah, even chiropractors.
Does it apply to
Yeah.
podcasts?
I don't know.
It can, yeah.
There-
Absolutely.
There comes a
Absolutely.
point when you run out of money.
Absolutely.
Well, so the Forward Thinking Chiropractic Alliance, I was trying
Yeah.
to put it into perspective for Kathy because I think it's best known for it's got a Facebook group. And now that people have heard this, you're probably going to get 5 people that want to
blow
join.
I hope so.
Yeah.
Blow
I
up.
hope so. It's going to blow up big.
Yeah, huge. So, but it's a huge Facebook group. Like a lot of people, if you're like in some mom's like kids Facebook group, it's like 500 people. Your Facebook group has over 10,000 people
Wow.
in
Close
it.
to 12, yeah.
Yeah.
Wow.
Well, okay.
That's incredible.
And there's 70,000 chiropractors.
Which isn't unusual. I mean, there are other chiropractic Facebook groups
Yeah.
that have 10,000, 12,000 or whatever,
Mm-hmm.
but they're not as the traffic heavy. They're
Yeah.
not as active.
Yeah. There's
Okay.
and it's 75% bots.
Yeah,
So,
one of
yeah.
the reasons is we get rid of all the nonsense.
Yes.
Mm.
So this
It's
group,
highly curated.
people
Yeah.
can talk about whatever they want. But
Yeah.
you have to fit within a certain boundary. And we don't let
Absolutely.
the spammers in, and we don't
Right.
let like nonsense conversations happen.
Right.
And yeah,
Nice.
when there's sort of a jerk
Mhm.
in the group, we just you
Yeah.
can find somewhere else to do that stuff.
Yeah.
Yeah.
So it's moderated pretty nicely.
And that's one of the things that's nice about it. And the thing is, I think one of the things that's impressive about it is there's people that think that it's like, oh, it's all about your philosophy and that's what gets you kicked out and not. And that's not true because there's people in there that have different philosophical views. It is about your behavior.
Yeah.
Because I think that there's even people who philosophically, we align with, but they can't behave themselves. And so it's like, hasta la bye-bye.
Yeah.
Well, you have to also remember this, like I said, this group has been around for over a decade,
Mm.
12 years going on 13 now.
Wow.
Mm-hmm.
When I first started, it was very split on that sort of
Yeah.
philosophy. It was an escape or a safe place for evidence-based chiropractors to have a conversation without the straight chiropractors coming in and blowing up the conversation.
Mhm.
That was what they were the best at. They're just coming in.
Put down your vaccines.
You'd want to,
Yeah.
random vaccine talks, or
Yeah.
you would even just be talking about a concept of rehabilitation. Like, why are
Mhm.
you talking about rehab? All you have to do is adjust C1 and
Yeah.
And they're
that
good.
takes care of everything. So it was a little more pedantic and like
Mm-hmm.
Mhm.
serious in the beginning as far as
Yeah.
like the party lines.
Right.
But I met this guy named Gray Cook.
Mm.
Have you ever
Mhm.
met him,
Yes.
Kathy?
I haven't never met him, but I know who it
And
is. Yeah.
we had breakfast because he spoke at one of our forward thinking events.
And he's a
Mhm.
physical therapist.
Yes.
He's
Yeah.
a physical
Yeah.
therapist. And I had breakfast with them every morning. And it was kind of like my extra bonus treat for inviting him along.
Mhm.
And he kind of knew about the FTCA and what it was doing. He knew I was kind of like trying to fight the bad guys. I'm
Right.
just using air quotes because they're not
Right.
bad
Yeah.
guys.
No.
They just have a really dumb old philosophy from the 1800s, right?
Yeah.
Mhm.
And on the way out, on his last day, our last breakfast together, he's like, Bobby, he's got his southern drawl, you know.
Yeah.
He's like, I got to catch a flight, but I just want to let you know something before I leave. You can fight evil if you want to,
Mm.
but you're going to get some on you. And then he winked and he walked off, like just walked off like a
Mhm.
space cowboy.
There
like,
Yeah.
he
from the
goes.
distance.
Yeah.
Okay.
I was like,
And
you,
Well,
Yeah.
and if you know
Kids say-
Gray, you think that
Yes.
I'm picturing him walking away, and he's got a guitar over his shoulder.
and he's got a glint in his eye.
Yeah,
Like, he's
like-
like, I got it. I got it. And I knew then, like, all right, we have to be a little bit more diplomatic about what we're
Politic.
doing here.
Mhm.
Yeah.
And allow people who maybe don't agree with what we're doing to at least hear what we're saying.
Right.
And then if they
Right.
can find a place and behave,
Yes.
Mhm.
more people are going to hear this conversation from a sort of a positive angle.
Mhm.
Yeah.
And then we also learned that some of the evidence-based chiropractors are kind of jerks too. Like,
Yeah.
Yes.
Totally.
and they've got their own pedantic things that they
Mhm.
go on about and
Mhm.
are intolerant as well. And so those
Mhm.
folks had to go too.
Yeah.
Yeah. So it's nice because it's heavily curated, and it is a love-hate thing. You love it or you hate it.
Yeah.
I love it. I've gotten a lot out of it. So and I'm being paid very well to say that.
Deep
So-
pockets, huh?
Well, that
Yeah.
thing gave me cancer. So
Yeah, and we should talk about that because I think that well, I'll tell you about this from a groupie's standpoint. Like you weren't really like public about this until you were.
Right.
Until you had to be, really. And I think that to a lot of people it just really came as a shock. It was like, whoa, holy crap, like something's wrong with Bobby, because at the same time, we had also in that group, we had taken some hits.
yeah, we
From-
lost two greats.
Yeah,
Yeah.
two
Greg
Gregs.
Malachuk and Greg Friedman at the same
Yeah.
time.
Just amazing people.
They
Yeah.
passed away.
Same thing, cancer. Yeah.
Wow.
And they were very stoic and silent about their
Mm.
illness and their struggles. Yeah.
Yes.
Mm.
And there was mixed feelings about that,
Mhm.
which it's okay to have mixed feelings about it because it's their business. They can do it however they want.
Yeah.
But there was some people that were like, whoa, wait, what? You're gone, and it hit a little harder. So it was scary to find out that you were dealing with this, and then to kind of see you go through that. And the thing that really kind of was like, holy crap, I gotta get Bobby on right now, was you sent out an amazing email about your experience, and I
Oh,
sent it
told
to
me about that,
Kathy.
Yeah.
Oh, yeah.
And yeah, so you want to just kind of walk us through like the beginning parts about that? Like, how do you even find out that you have cancer?
Sure. Well, and then in retrospect, I'm looking back at that email and I'm like, oh, this looks like one of those horrible LinkedIn articles. Like 5 things cancer taught me about network marketing. Or something. But there were like 3 main points I took away. But
Yeah.
we can go to the beginning for sure.
Yeah.
It's not like what you read in the textbook as a provider,
Mm.
that someone's going to show up with these certain cardinal
Mhm.
things and you're
Yeah.
just going to go, oh.
Oh.
Although that has happened in my career where
Sure.
someone's walked in with the cardinal signs,
Yeah.
night sweats, unexplained weight loss, and all that
Mhm.
stuff. And you go,
Mhm.
oh, I know what this is.
Right.
When you're a provider or are supposed to be a smart person, you actually don't figure it out that quickly.
Mm.
Like Occam's razor takes control.
Sure.
Mm.
Like, it's going to be the most obvious thing because I'm youngish and
Yeah.
I'm healthy-ish and
Mhm.
And I've never had cancer,
I've never
so
had
how
it,
would
you
I
know.
how would I get it?
Right.
And it's not in my family. It's not like a thing. And
Mhm.
we came home from, it was before a family vacation to Mexico, just wasn't feeling good.
Mm.
Mhm.
Not that big of a deal. And it was after an ACA convention, which
Mm.
those people, I'm just joking. I'm
Yeah.
the Oregon representative for the American Chiropractic Association. But after coming back from the convention, you always feel a little wrecked.
You're like, it's
Yeah,
an
you're-
ulcer. No.
Yeah, no.
These
It's those
folks,
people.
It's indigestion.
Like malaise.
Yeah.
And then when you're on vacation, you should be having a good time. And I wasn't
Sure.
having a good time.
Mm.
Coming back from the vacation, it felt like a little bit of back pain. not that big of a deal. I've
Right.
had back pain. I'm going to do all my things.
Right.
I'm going to do all the things I know how to do.
Right.
Didn't get better.
Wait, the foam roller didn't fix it?
My
Did the foam
McGill's
roller
Big Three?
Yeah, did the foam roller vibrate though?
The foam roller.
You didn't try.
I didn't have one of
Hyper-Race.
those. That was probably the
That was
difference.
it.
That was probably it.
That
yeah.
was it.
Difference. All the things didn't kind of work. I was consulting my little AI chatbot thing. And
Yes.
what do you think it is? Give me some differentials. That's a mistake, and I want to say that right now for
Yeah.
everybody out there who's listening. Both of you, listen up. Don't.
We know their names. Do you want me to call them by
consult
name?
AI for your possible healthcare conditions.
No.
Even if you think you know what you're doing, or even if you trust it, it's probably going to be wrong diagnostic.
Right.
It's probably going to tell you the thing you want to hear.
Yes.
And so it told me all the Occam's razors things.
Mhm.
Oh, it's indigestion.
Kidney stones.
So take a supplement.
Mhm.
Oh, it's kidney stones.
Mhm.
So take a little cranberry juice. Maybe you should see your doctor.
Yeah.
All these sort of things. It got to the point, and I was walking. I did go to PT for
Okay.
back pain.
Yeah.
Mhm.
And it helped with some of the back pain because I actually was having some back pain because I couldn't sleep.
Yeah.
Mhm.
Oh.
And this was the weird part. If you've got pain that you don't understand,
Mm-hmm.
you have somebody figure out what it is. Because my
Yeah.
back pain wasn't pain. It was like I would lay down on my back and feel this tremendous anxiety.
Oh.
Like my body
interesting.
saying, no, don't lay in this position. And I would get up,
Wow,
that was
okay.
weird.
Yeah.
And then I would just lay in a different position and sleep. But as
Mhm.
the tumor progressed, I would get onto my side, and then I would get the same sensation. No, don't lay that way. So I was slowly and surely like encased in this only one position I could ever sleep in, and that was almost like sitting up in a chair.
Interesting.
This is where
Yeah.
you should sort of be like, something's going on here.
Yeah.
Yeah. How long did that last?
So
back to the AI
period-
chatbot. No.
that period was actually pretty short. So
Okay.
we're talking May, June, July is the period where all the things were developing.
Mm-hmm.
Now, in that time, I was seeking health care. They just weren't finding it.
Okay.
Mhm.
And you don't always get the mnemonic words from your patient of like, oh, I have unexplained weight loss,
Yeah.
doctor.
Yeah. I have intractable pain.
I was actually losing weight on purpose at the same time.
Okay.
So a lot of this stuff overlays, right?
Yeah.
For my A1C was 10 when this started. And that's absurd.
Yeah.
Mhm.
It's very high.
When
Like
I
the
took-
normal range is 5.5.
Yeah.
And
Yeah.
then after I did my walk, it was back to
Mhm.
5.5, whatever.
Mhm.
Okay.
So we'll just take that as an aside. It was probably a tumor-induced hyperglycemia, but we're
Sure.
not going to go there right now.
Mhm.
Right.
But they were like, your A1C is 10. That's ridiculous. You're diabetic. I'm like,
Mhm.
shh, not me.
Yeah.
Yeah.
And I was right. It's not me.
Mhm.
Something was wrong, but they didn't want to go beyond the
Yeah.
easy to find
Mm.
diabetes diagnosis.
Right.
Well, and do you think that there's a piece of it because I don't know if your providers know that you're a healthcare provider, but sometimes I worry that I'm looking for the most favorable diagnosis because I don't want to have that conversation with the healthcare provider. There's something really wrong with you,
Mm-hmm.
right? Do you think that played into
I
it
try
at
to
all?
be really honest, and I've got an example of this as well. I try to be really honest with my symptoms, my conditions, and not try to frame it in a way that would be favorable because I knew that I would do that. I knew that I
Yeah.
would have bias.
Yeah.
Sure.
I did want, by the time I went to the doctor, I wanted them to figure it out.
Mm-hmm.
Yeah.
And by the time I went to the doctor, it was the ER because I had not slept for 2 days. My normal routine was to go on a little walk
Yeah.
and I would feel a little better and then I'd be able to sleep after
Mhm.
moving and stretching and all that
Mhm.
stuff. After I would go to pee, I would feel much better and go to sleep.
Interesting.
And when you're a physician or a healthcare provider and you're listening to all these, like listening to me say these things, you're like, oh well, of course,
Mhm.
sure, of course. When you're living them, it's not of course.
Yeah.
It
No.
doesn't make sense.
Yep.
When I would start to then do my walk in the middle of the night, I would have to do it in the middle of the night with a little lamp on
Mhm.
because that's when the pain was the worst. I would go out into the bushes and just hurl in the bushes
Oh.
to get relief and then
Yeah.
come back home and go to
Oh,
sleep.
my goodness.
That's like I'm going to the doctor.
Yeah.
Mhm.
Yeah.
And the night that instigated it the most, because I did think it was kidney stones, but I thought they
Sure.
would sort of pass.
Sure. Yeah.
Yeah.
I'd pass the stone or whatever.
Mhm.
Right.
That's not right, but
Mm-hmm.
I never said I was smart.
Yeah. Well,
I'm just charismatic.
I mean, one of the most painful things in the world is cognitive dissonance.
Yeah.
You know, where
Not a
it's
kidney
like-
stone, cognitive dissonance.
Yeah.
Yeah.
Yes.
Yeah. Absolutely. It's just like it can't be. And
Right.
There's other people that are very talented and they think that everything's wrong with them, you know. But
So I went to the emergency department
Mhm,
and I thought I was going to be very open with my symptoms.
mhm,
I said, I'm going to lay it all out, everything that I've experienced. I'm going to lay out to this doctor. So I'm
Right.
going to say so many of the right words. She's going to get it
Right.
mhm.
and she's going to solve this.
Right.
And I gave her all the words and I laid it out there. And she was like, so you have pain when you're laying down on your back? Well, yeah, at nighttime, but it's not pain. It's more like an anxiety. She's like, oh, anxiety.
Mm.
Mhm.
I'm like, well, yeah, but it's also like it's hard to describe,
Yeah.
which should be the sort
Yeah.
of like
Right.
the factor. Like,
Yeah.
She's
should
like, "Have
be
you
like-
heard of Prozac?"
Yeah. Exactly.
and that's where we're going. She
Yeah.
did probably the worst. She
Yeah.
probably did the worst physical exam you could possibly imagine.
Yeah.
And no one will ever know her name, and
Sure,
she never got
sure.
beat up for this, so no one's
Mhm.
ever going to know who it was. And I almost said her name.
Nobody's gonna know that her name is Dr. Jill. No,
But she said, I think you just have anxiety around your pain,
Mm.
and you need some trazodone or trazodone or whatever
Mhm,
To sleep.
to sleep.
mhm.
And I'm like, yeah, lady, I do have some anxiety around
Yeah.
the pain.
Yeah. You're right about
And I
that.
was
part.
like, are you
Do you
serious?
know where I am?
Are you serious?
Uh-huh.
Yeah.
And I'm
That's
looking at
it.
she's like, bye, and I can hear her in the next room over talking to that patient.
Mhm.
I think you just have anxiety for your pain. So here's some
Same
trazodone or
thing?
what- Yeah. And I'm like, oh no. So I went home, told my wife, I'm like, and my wife was like, that's garbage. All these,
Yeah.
you with your PG-13, man.
Yeah. I know
don't
we
have
had to
I don't
tell
have any
it's a
cuss word.
PG-13
I don't have any
show.
cuss word outs
Yeah.
here.
Oh, sorry.
But I called my
Mhm.
primary care provider. So that was nonsense. I want
Yeah.
more investigation here.
Yeah.
Mhm.
But that took 3 weeks to get
Ah.
in.
Of course.
So that was
Yeah.
the big delay in the
3 weeks, that's pretty
Wow.
quick.
Yeah. Yeah, it is.
Walked
kinda
in, told my primary care provider the exact stuff. She was like, oh, CT right away.
Yeah.
Mhm.
By the time I got home, they were already on the phone, like, come back, go to the ER.
Yeah.
And I just looked at my wife, I'm like, that can never be good. That's
Yeah.
not, that's
do
not a
not.
kidney stone.
No.
He's like, it's a hangnail.
And
Dang it.
I gave her a hug, and that was it. And they were like, you've got a massive tumor in your tummy. They said tummy, but it wasn't. You've got a massive tumor in your tummy that has encased your aorta and is constricting it.
Blah.
That's
And
not
so we're taking you upstairs right now.
good.
Yes, you are. I was like, what's upstairs?
The aorta.
Hopefully not the morgue.
Wow.
No, that's
Yeah.
that's in the basement.
Yeah.
Typically that's in the basement or right behind the ER. Yeah.
There we go.
So that's when it all started, and that was like, during that
Wow.
scenario, I only had empathy for the doctor in the ER who had to tell me.
Yeah.
Yeah.
I didn't even
Yeah.
have empathy for myself. I mean, it was a
Mhm.
shock, of course.
Yeah.
But I'm like, man, I feel bad for you that you have to say that.
Yeah.
Yeah.
Gosh, I
Yeah.
can't even imagine.
So germ cell tumor. I always call them giant cell tumor.
Mhm.
Germ cell tumor, retroperitoneal, right in between the aorta and the kidney, but they're not balls. Some people think of tumors as balls.
Yeah.
They're more like
Masses.
amorphous thing that's
Yeah.
just taking up space.
Yeah.
Mhm.
And it was filling up space around the aorta,
Whoa.
pushing on the kidneys. That's why it felt like a
That's
kidney
why it
stone.
hurt. Okay.
Yeah. And they were like, I mean, germ cell tumors do not go to like the stage 4 where they kill you per se,
Hmm.
but they can because they take up so much space.
Yeah.
Yeah.
They
They're gonna
suffocate you
destroy the
basically.
organ.
Yeah.
Yeah.
Weird question. Did you name it?
Once again, you've got a PG-13.
So the answer is yes.
I had a couple names for it. Yeah, I had a couple names for it.
You mother. No.
So
Yeah.
squeezing your aorta, you didn't really have a
Excuse me.
ton of pain symptoms.
No, and vascular surgeons checked it out.
Yeah.
I think it visually looked like it was compressing the aorta, but it wasn't actually
Okay.
structurally,
Okay.
physically, or physiologically.
Mhm.
Yeah.
Mm-hmm.
Okay.
Your brain knew it was there, and that's where the anxiety was, I think. I mean, in my estimation, it feels like.
In retrospect, everything always makes sense.
Right.
I had, well, we haven't discussed yet, but I'm a basketball official. So this was happening around June of last year
Mhm.
in that summer league
Yeah.
and summer
Oh.
camps and things. I did
Yeah.
all summer league. I
Wow.
did camps all the way up. I mean, that to the end of June, there was a 3-week period where it just got extremely worse within those 3 weeks.
Yeah.
So I was perfectly physically active.
Hmm.
I mean, there are some signs where if I look back, I'm like, oh no, I wasn't doing that good.
Mm.
And my
Yeah.
wife was like, no, you could see it in your eyes that you were sick somehow, but no
Hmm.
one knew what it was.
Right.
Yeah.
And obviously I wasn't sleeping, but like
Yeah.
2 hours a night on any
Mm.
given night.
Mm.
But
Wow.
none of that stuff like really sort of clicked. And I do want to say there are 3 phases to this process. The first phase, and this is for anybody who's not gone through this, who's hasn't had a family member who's had serious illness or cancer, someone who hasn't had it themselves. The first phase is when they're trying to figure out what's going on.
Yeah.
And that might be the worst, is when nobody really knows what it is. Because a retroperitoneal tumor can be a number of things. One of them, the worst case scenario, is probably lymphoma, which has a very poor survival rate.
Yeah.
And that's what they thought it was. So I thought I was gone. I was a goner at that point. So they're like, that's number 1 on the differential list.
Yeah.
Number 2 would be these germ cell tumors. And there were some other stuff further down, these IgGF type of like inflammatory diseases. And they were kind of like, we hope it's that because that's the one you kind of want.
Right.
Yeah.
And I'm looking at the doctor, the inpatient doctor, and I was like, but it's not that, is it? She's like, no, it's not that. We're gonna look. We're gonna look anyways. It's not that.
Oh, bless your heart. Bless your heart.
No. She was very awesome because I'm like, I didn't want the CAT scans. I'm still sort of in the naturalistic fallacy type. Like, I don't want
imaging.
Tons of imaging. Like, stop wanting to keep scanning me. And she's like, look, dude, you're gonna do all this stuff. You've got little kids. You're gonna do all of it. You're gonna do everything you need to do. You're gonna get all the scans because you have to. You got the family and the kids.
Yeah. You want to win. You got to do all the things.
Well, shoot me up.
Yeah. Right.
The second phase is when you need the treatment. So whatever the treatment is.
Right.
And in my case, it was chemotherapy.
Okay.
For germ cell tumors, they can also do retroperitoneal lymph node dissection because it's usually a lymph node that's blown out of.
Oh, gotcha.
Okay.
And they'll go in and they'll take the other lymph nodes out, usually with a robot.
Okay.
Like a 4-pronged robot will go in and laser them out. And then there's some other therapies as well. I mean, obviously with men, germ cell tumors are typically testicular cancer, and they're going to take one of your boys in the process and all this. And so you got to go through that treatment process, which is its own different hell. And we'll talk about that. And then the final third piece of hell is after. Like, what is the rest of my life like?
Yeah.
Right.
What does it come back?
Right.
Does it?
Yeah.
The consequences of chemotherapy, which are actually the most annoying thing of the whole process.
Yeah. And it's not free, is it? It costs some money.
It does cost some money.
Yeah, to beat cancer.
Blessings in place. This was all done through the Department of Veterans Affairs and the VA hospital.
Nice.
And I received some of the best care I could have possibly imagined in my entire life. When people kind of poo-poo on the VA quite a bit, the most top-notch. Now, in Oregon, we have an advantage. They're right next door to OHSU.
Yeah.
Okay.
And they work hand in hand together. And OHSU works very closely. Like, they have experts in germ cell tumors and managing these types of cancers. So I was in the best hands probably on earth in this case. And the almost died part, it was the treatment phase.
Yeah.
I wasn't going to die because germ cell tumors are very chemosensitive, and I had a 95% survival.
Nice. That's good
When
to
the
hear. That's a good stat.
oncologist was like, 98% chance, we're going to cure this is curable. It's not. He didn't say it was not that big of a deal.
Yeah.
Well, definitely. Because if you do nothing,
it's got a 98% cure rate. And I'm like, what's cure? What do you mean by cure? What is a cure?
Right.
Here. Like, I live another 5 years.
Yeah, it's like 5 year 5 year survival ability.
It is defined
rate.
as the 5-year survival rate when we considered cure. If you've made it to 5 years, then you've been cured.
Okay.
But he's like, no, you'll live a normal life. And I'm like,
okay.
You got to be.
Yeah. What a relief, right?
And then he said, but the chemotherapy program we're going to put you through is probably one of the worst ones you could ever imagine. Because of how big it got.
Yeah.
And how many rounds I had to go through. 4 rounds. It's going to be close. And chemotherapy is a game of, you guys remember The Price is Right?
Yeah.
Oh, yeah.
Where you had to like make a bid, like how close can you get to $1 without going over?
Yeah.
Chemotherapy is how close can we get to killing you without going over?
Yeah.
Wow.
And it was that.
Well, and I'll tell you, so October, right? I see you at this conference, and
What is that, 6 months ago by this recording time?
Yeah, 6 months ago. And you're simultaneously like my hero, but you're an idiot.
Yeah.
because
Those are the best ones.
Yeah, we have you organize this big conference in Portland, and there's hundreds of people, and there's dozens of speakers, and you're there, right? And I showed up at the school. And I see the president of the school walking around. I see an administrator of the school walking around. They're walking around with this old guy, and I don't know who he is. And I'm like, "Where's Bobby?" And it's like, and they're coming down the stairs, and I'm like, "Oh crap, that's Bobby, right?" And so like they took you to the brink. You had to leave
I
during
got
the
admitted
conference.
after that. I got admitted the next day.
Yeah,
Wow.
yeah. I mean, halfway through the conference, you're in the hospital because that took a lot out of you. And watching you work through this, like. You weren't even at the conference the whole time when you were at the conference. And so
My wife and 2 daughters did most of the work.
yeah, they were amazing. They did so much.
A 12-year-old and a 9-year-old.
Yeah.
And my wife did most of the work.
Wow.
Yeah. And it was insane. So like totally over the top. You have an amazing family.
Yes.
But the thing, so first of all, thank you for your dedication, because you definitely should not have been there. But also, if you're not there, important things don't happen in the profession. So that's a huge
it was all
deal.
booked before
Yeah.
I was even had any idea what was going on.
Wow.
Yeah.
I don't quit.
And nobody would have
quitting's
faulted
going to be
you.
a theme later on in this podcast.
Good,
Okay.
good. Yes. Yeah. And nobody would have faulted you for saying, "Look,
Hey.
guys, I've got cancer. I'm not gonna have your conference."
Well, that's why I took the second day off. They're like, you can take the second day off.
If you can't pull the cancer card, what card can you pull?
Well, I didn't know that. Like, I didn't know that.
Yeah.
Like, I've never been like forgiving of myself, or giving myself the grace to sort of stop and be like, I'm tired, I'm hurting, I'm burnt out, or whatever. And this whole thing was like, I've never been cared for. They always say like, a man gets his first bouquet of flowers on his funeral.
Yeah, right.
Yeah, I never had people be like, you need to take care of yourself.
Yeah.
You need to stop and just.
Mm-hmm.
My wife, we just, Jason, you're gonna hate this. My son enrolled in the University of Oregon.
Jeez.
Boy.
Shut
See,
up, Raul.
Raul's over
Raul's
there.
over there. And he's like, no, that's not the hard
no.
thing. See, I knew it. You were doing the whole time. You liar.
Raul broke the third wall.
Jeez. Okay. So
But that left a bedroom open in the house. And
Uh-huh.
my wife made it like a hermetically sealed, silent, dark place for me just to go and sleep.
okay.
And, that was huge to have a place to go. And
Right.
just disappear. And
Yeah.
because I hear of, we were flying to Mexico this year for our vacation to celebrate life and all that.
Yeah. Hey,
And,
look at us.
And the kids wanted pancakes at the McDonald's. It's in the airport. It's like the only thing that's open in the morning or
Yeah.
whatever. No, that's the only, they love McDonald's. What are we talking about?
What?
Those hotcakes are something else.
Yeah.
But the dude that was working the McDonald's stand, like his other buddies at the airport was like, "Hey, what's wrong with you, Hector? What's wrong with, like, you look all jacked up." It's like, "Yeah, I got cancer, bro. I got testicular cancer, man.
What?
I just had chemo, so I lost all my hair." And they're like, "What are you doing here?" He's like, "I got to work, bro. I got to
Yeah.
work." And I was like, my
Whoa.
friend.
Wow.
Whoa.
Yeah.
Because I couldn't move it. I mean, I couldn't even do those events are,
Yeah.
all the work is in the planning.
Yeah.
The showing up part is just to make sure everyone's having a good time and everything kind of flows.
Yeah.
I could barely walk.
Wow.
Yeah.
He might not have been into his 4th round of chemo.
Yeah.
Mhm.
But just the things that people do to keep fighting. And this is, I'll just say the point now, if there's patients listening,
Yeah.
Mhm.
or if you ever become a patient, there were times on the chemo infusion ward, I would be up there 4 or 5 days a week. And I saw people quit a lot. Just like, I don't want to do it anymore.
Right.
I made my decision. This is over. I'm
Right.
not doing this stuff anymore. Blah,
Right.
blah, blah. Or whining. So remember, this is VA healthcare. So a lot of this stuff is free to a lot of these
Yes.
folks. And they would whine a lot about what they were getting.
Mhm.
And the dollar signs are running through my
Yeah.
mind.
Yeah.
Like,
Right.
my goodness.
Yeah.
And the whiners and the quitters never made it.
Yeah.
It's not that they disappeared and went off
Yeah.
home and they died.
Yeah.
And I mean, even if you're just a PT or a chiro patient
Mhm.
and you've got a disc, or
Yeah.
you've got a
Right.
tendon rupture, or you've got pain from a car accident, The whiners and the quitters don't make it.
Right.
Be a good patient and don't be a whiner or quitter.
Mm-hmm.
That might be tough
Yeah.
or tough love or whatever,
Right.
but those folks never make it through their health
It's
conditions.
Do you remember? Oh, geez, what was this guy's? The doctor who he was the attending at the Burnside Clinic. Oh, Owen.
Yeah, I love that guy.
Yeah.
Yeah.
Is that-
Owen. I want to say Owen Wilson, but that's the actor.
No.
Yeah.
No, but he was amazing.
He was my guy, man.
Yeah.
I always worked at that Burnside Clinic because you could get all of your patient visit credits.
Yeah,
Mm.
totally.
Like you can bank them real quick.
And it was so it
You
was
just
a
had to deal with some urine and
Ah.
stuff like that, but
urine and prostitutes. Yeah. So it was the free clinic downtown Portland on Burnside Avenue. And it was like one of those kind of like no questions asked clinics. You got something, you need help. And it was interesting because you get nothing. You get your hands and
Yeah.
you get your mind and you get your skills, and that's it. There's no electrostim, there's no extensive treatment plan or anything like that.
no
You
vibrating foam roller.
no, not even a regular foam roller. So, but the attending doctor there, man, I feel so bad that I can't remember. He's not listening anyway. But he was amazing because man, he just cared so much.
Yeah.
And he was a guy who refused to let people quit, but he refused to let them quit through accountability rather than like, oh, please don't quit. Please don't
Right.
quit.
Mhm.
I remember I had a patient who, this guy, I don't know if he thought we were going to give him drugs or whatever, if he complained enough, but he's like, oh my, I'm bone and my back is broken and I can't do that. And so he walked in, he's like, your back hurts? And he's like, yeah, it's killing me. He's like, so what happens if you fall off that chiropractic table? He's like, I don't know. And then the guy slides off the table onto the floor. And he's like, so what are you going to do now? And he's like, oh, I just need help. I need help. And he's like, are you just going to lay on my floor forever? And he's like, well, no. He's like, get off the floor. And so the guy is like, what? He's like, get off the floor. And so then the guy like pushes himself off the floor. He's like, stand on your feet. So he stands on his feet. And the guy's like, oh, my back. He's like, get back on the floor. And so the guy like gets back on the floor. And so he had this guy doing get-ups. He had him doing
Oh.
squats.
Couple reps in there.
And he's like, look, you can do that. He said, you're going to do whatever it is that you want to do. You just need to quit the whining and everything and get it done.
Wow.
And I was like, what?
Okay.
And so every once in a while, I had to flip that switch in my
Mhm.
clinic.
Mhm.
You know?
I'm telling you, he's
Yeah.
my guy.
Yeah.
I'm not lying that I
Yeah.
used that same exact thing for
Yeah.
patients in my own clinic that
Absolutely.
I learned from the doctor whose name I
Mhm.
can't remember.
Yeah.
Owen.
There's an
great,
Owen in there.
We love you, Owen. You're the
Lynch.
best.
Yeah, patient slid off
Lynch,
the table.
Owen Lynch.
And his
How
wife,
can you
Owen
not
Lynch. That's
forget-
it. Yes, thank
Yes,
you.
that's it.
It's
Forget
not that we
that guy.
don't forget
Yes.
the name. It's
No.
it just takes time to register.
How can you
Yes,
forget that
absolutely.
It's been
guy?
it's been a veritable
Long
it's
lost
been
cousin.
a mare de noms. It's been a sea of names these 20 years.
Yeah.
Yeah.
Patient slid off the table and
Yeah.
the wife was screaming like, you gonna help him up? I told him not to get on the table like that or he might slide off. Well, what are you
Yeah.
gonna do now? I'm gonna watch him get up.
Yeah.
You're not gonna pick him up. What are you gonna do? I'm not doing anything.
I'm also not going to drive to his house when that happens
Yes.
and pick him up
He's
there
gotta
either.
get up on his own.
And he's not going to expect me to, you know? And so I think that that's a really important point, though, is it doesn't matter big problems, little problems, whatever it is. It's like you have to make a decision not to quit.
Yeah.
Mhm.
Yeah. So, can you talk a little bit about the providers? Like, I want to read this portion of
Yeah, the nuts and
of your
bolts of why
article
we're
here.
even here talking.
Yeah,
Mhm.
you
That
said-
intro was that's the intro. We just got
What?
this started.
Yeah,
We just started.
And now, so you said because this letter that you wrote was aimed at chiropractors, and kind of encouraging us to just be better. Let me see. I hope I'm reading the right
You don't have
part.
to read it.
I'm
I
gonna-
lived it.
I'm gonna. Yeah,
You-
I'm
We
reading it
wanna
for the
hear
benefit
it.
of everybody else.
Okay.
I'm going to go through two paragraphs. One of the things I observed, which isn't earth-shattering, is that healthcare providers have a varying level of skills and competencies. Not everyone you encounter in healthcare has their stuff together. This is all the way up and down the line: physicians, nurses, technicians, and chiropractors. However, when your life is on the line, or your spine, or some other health issue that you value very much, the competency of the provider becomes a very high priority concern as a patient. On these daily trips to the hospital, I began to know who on duty had their stuff together and who didn't. And the anxiety that could be felt when I was assigned an incompetent was significant.
Mhm.
I wrote that.
You did.
Dang, that was
Yes.
pretty good. Yeah,
It's beautiful. Yeah.
It's everything.
It
Yeah.
is.
So I've never been a patient like that. So it
Yeah.
could just be everyone like, yeah, no duh,
Yeah.
because I've never been a patient like that.
Mhm.
But I think there's a lot of young PTs and chiros
Mm-hmm.
who they're young and active and strong, and
Mhm.
they're adjusting people that don't need to be adjusted in clinic because they're all rubber and bouncy and they never
Yeah,
get an accident.
right.
There's
Right.
and it's like they've never been a patient of that caliber where you have to walk in and you're like, I sure hope this person knows what they're doing.
Mhm.
Now, the highest scale of that, of course, is like a surgeon.
Sure.
Yeah.
Yeah.
That would be the highest I can imagine.
Absolutely.
Like a brain surgeon.
Neurosurgeon.
I
That's
sure
what I was
hope the
thinking.
neurosurgeon knows what they're
Yes.
doing. But it
Yeah.
goes the anxiety would then be on a spectrum, right? And all the way
Yes.
down, but there's still an anxiety that exists in the what would you call us? The physical rehabilitative world.
Yeah.
Mhm.
Manual medicine.
And as you know, there are some people that carry more anxiety than others. So they come into our office, even if it is just manual therapy, rehab, and
Right.
all that, with a very high level anxiety. Like, I sure hope this person knows what they're going to do. They're not going to break my neck
Right.
Mm-hmm.
or rip
Right.
my shoulder out of its socket
Yep.
or whatever.
Mm-hmm.
And you would be able to identify specifically who was working that you knew they could
Yes.
get it done, and you knew you were going to have a good day on
Mhm.
the chemotherapy ward that day.
Yeah.
Mhm.
And
Mhm.
you knew the ones that they just didn't have it,
Mhm.
and you knew they were going to miss. So there's a thing you get it's called a power report. I
Yeah.
still have
Mhm.
mine.
Mhm.
They keep it in you for like a 9 months to a year, just
Yeah.
in case.
Just in
Right.
case.
Just in
yeah.
case,
Yeah.
Just a reminder.
Thanks for reminding me
Yeah.
every single
Yeah.
day,
Yeah.
that I've got this thing sticking out of my chest. It is extremely painful. It's a very large, like, I don't know the size of the needle, 20 gauge,
Mhm.
2-inch long needle.
Yeah.
Because this thing's attached to my inferior vena cava.
Right.
So they jam that thing into your skin every time they want to do a lot of IV therapy so they don't fry your veins
Right.
in your arms. There are some nurses that can get in there and you don't feel anything.
Painless.
Yeah.
And there's some, it is like, it's like getting stabbed.
Yeah.
It's like you're at a Mexican cockfight and you made a wrong bet, and someone just put one right in your chest.
And they just keep poking you.
From what I've heard.
Yeah.
Yeah. How would you know?
And then it hurts just as bad pulling out.
Mm.
Yeah.
And so there's a lot of anxiety just going into the clinic that day.
Yeah.
Like, are they going to, is this
Mhm.
one going to be a tearjerker or
Mhm.
what?
Mhm.
So competency is huge. And my epiphany was that this competency is all the way up and down the road.
Yeah.
Yeah.
And if you can manage that competency, you get a long way in building patient trust. And of course, as we know, patient
Yeah.
trust is the gold standard here for
Yeah.
building a great relationship clinically and
Well,
personally with the
and I
patient.
think that you were talking about competency not just from the standpoint of technique, right?
No, right.
Yeah.
Exactly.
Mhm.
That matters.
Yeah.
Mhm.
So in our case, it would be, in the chiropractor's case, delivering the adjustment.
Mhm.
You do have to deliver a comfortable, effective,
Mm-hmm.
non-anxiety building,
Yes.
non-painful adjustment.
I like to refer to it as a good crispy adjustment.
Yeah.
Right. Mhm.
Nice and crisp. You want to
Crispy
be,
and smooth.
yeah.
Yeah.
You only want to be a terrorist within like a millimeter. You don't want to terrorize the patient
Uh-huh.
throughout the whole range of motion.
Absolutely.
But just in the whole process, the greeting process, the
Yes.
patient experience process, the managing expectations
Mhm.
process,
Mm-hmm.
how you handle your instrumentation, how you perform an examination. If you take radiographs in your clinic, like how you prepare the patient, gowning, effective communication, respecting their cultural differences compared to yours, like all these things translate into a patient like this person knows what they're doing.
Right.
They care that I'm here, and I'm in good hands.
Mhm.
In a medical setting, it can be as simple as like, yes, how they do the injection.
Yeah.
I definitely remember nurses like fumbling things and dropping them on the ground.
Mm.
And me watching out of the corner of my eye, are they going to pick it up and throw it away, or are they going to use
Yeah.
it on me? And things like that. Like,
Yeah.
Fortunately, they picked it up and they licked it off. And then they used it, right? You don't want to
Whether-
go in dirty.
whether they were like, after they've got you going on your IV and they're off doing their other thing, or are they just talking about their next vacation and the
Mhm.
next room over? They chatting with the other nurses, or are they on their game and they're focused on what's going on?
Right.
Like all that stuff can be picked up by a
Mhm.
patient.
Mm-hmm.
Mhm.
And it was just like the feeling of being at complete and total mercy of whether they were competent or not was horrifying.
Mhm.
Yeah.
And it made me really understand a patient who comes into my own office
Mm-hmm.
and like, how can I make sure that they are not horrified by any perceived incompetence?
Right.
That's a great point. It's like when I get on airplanes.
Yes.
When I get on an airplane, I want somebody who
Peeking in
only
there.
has gray hair.
Yeah.
Yeah.
If there's any
Right.
color in your hair, or if you're bald, that's also
That's-
acceptable. Right?
Yes.
Men, women, I don't care. If
Yeah.
you're a bald lady, I will accept
Yeah,
that.
yeah.
Right. But man, if you look younger than me, then
Sure.
that makes me nervous,
Mhm.
right?
Everyone has their biases,
Right.
right? And
Sure.
some of them are completely inappropriate,
Mm-hmm.
but they happen.
Mm-hmm.
But, like I wouldn't want my pilot to show up in Crocs.
No.
Yeah, but yeah,
You know?
No.
right.
I
Mhm.
have scorned other chiropractors in the past by they show up in like bowling shirts and
Mhm.
like or wearing shorts.
Mhm.
And they have their own justifications like
Sure.
why I wear shorts to practice.
Yeah.
Like, yeah, but that's for you,
Mhm.
like your own personal comfort, or you're an
Mhm.
active person and you wanted to show that you're active. The person coming in off the street is making judgment calls like immediately
Mhm.
Yeah.
based on all these little things that you want to decide for yourself versus deciding for them.
Mhm.
And it ultimately comes down to the question, why are you here? Are you here for them or for you?
Right. Yeah, being a patient you're so vulnerable. You're in such a vulnerable position that plus you come in and you're on guard for everything. You're looking around. I mean, even the presentation of the office or the hospital,
The shape,
Right.
the shape of the room,
the shape of the room. Yeah, has this place been maintained? Does this need a
cleanliness of the bathroom.
Yeah. Is this paint job? This place chipping everywhere. Like, what's going on here?
Now
Right?
your name's Kathy.
Yes.
I'm not going to assume you're a woman, but maybe I am going to assuom you're a
Yes,
woman.
I am.
Okay.
I am.
Maybe I could have just asked. How do you identify?
I identify as
I could have
female.
just asked.
Yes.
Right?
Yeah.
But this is there's a book, Why Women Buy,
Yeah.
and it outlines a lot of these
Mhm.
things
Mhm.
about how women make decisions, like buying decisions, but
Yes.
healthcare is a buying decision
Yeah.
and what they're looking at.
Mhm.
And there's a lot of times when male clinicians don't even think about this stuff.
Yeah.
Like,
Right.
you've got like a bagel smear on
Yeah.
your shirt,
Yeah.
or you're making off-color jokes that have no
Mhm.
place. Or
Right.
chiropractors and PTs, we get a lot of patients that have been run through the mill
Yeah.
by the time they get to us.
Mhm.
Mhm.
And can you disarm a patient appropriately
Right.
so that you can then get to the work that needs to be
Well,
done?
and you spend a significant amount of time cleaning up after other providers, right?
There is
Where
that,
it's like,
yeah.
oh, geez, I went to this place and man, for some reason they were just talking about the Bible the whole time. And then, oh, I went over to this place and it smells like, Bengay and feet.
Mhm.
So it's like part of it is you have to kind of reset their expectation around the clinical experience that they're going to have.
Absolutely.
Mhm.
So I had 3 lessons that I can
Mhm.
pass on
Yeah.
Let's
that
have
I
'em.
learned about this subject.
Okay.
And I'm going to open up my notes.
Please.
Open up your notes.
Because they're not committed to memory. They're probably in that email that I sent. We could probably find that and send it
Yeah.
to other people if they wanted. But
Yeah, you know what? If it's okay with you, I will include the email in the show notes.
Sure.
Yeah, it was really very impactful.
lesson 1 we've already covered. The patients feel dependent on your competence,
Mhm.
and they're at the mercy of your competence. Which leads into the second lesson we haven't quite discussed yet, but maybe danced around, and that your competence has to be visible.
Mhm.
So people actually have to see the competence.
Mhm.
You know
Yeah.
you're competent.
Mhm.
Yeah.
Like all your colleagues know you're competent. You've
Yeah.
got all the letters after your name to say you're competent, but it's actually a little bit of showmanship.
Mhm.
It's actually like there's a performative function to
Yeah.
what you're doing to show the competency.
Right.
And most of us are not performers. We're not like, but if you can make your examination, I'm not saying like BJ Palmer where he was like adjusting in the stop motion.
Yeah, the hair goes flying.
We're not talking like that. We're not talking circus sideshow
Yeah.
performative, but there's got to be a dance that you put on
Sure.
for these folks that shows that you're working, you're thinking, you've got them in mind,
It's about them.
handle your instruments appropriately.
Mhm.
As a basketball official, we practice our signs in the mirror.
Yes.
Yeah.
Like how much do us clinical people practice what we're doing in a
Mhm.
mirror? Like we used to in adjusting class, like look and
Yeah.
oh, it looks kind of like,
Uh-huh.
but
Practice your wink before you.
yeah.
If
If you're demonstrating certain rehabilitative moves,
Mhm.
how do you actually know what it looks like to a patient?
Right.
Yeah.
Like, is it something that they can lock into their mind and say, when I go home, I'll remember how the doc was moving?
And you better be able to do it.
Yeah, you gotta
Yeah,
do
well,
it.
there's
Yeah,
that. At least
there is
one good rep.
One good rep.
At least one.
3 would be ideal.
And all that leads into trust. So lesson 3 is that perception that you've passed on
Mhm.
affects the patient experience.
Mhm.
And when you gain the trust, that's when you really win.
That's when they really win.
Patient wins too.
Yeah. Yeah, absolutely. Yeah, those are I think all those things really. I've been watching. Have you seen that show The Pit?
No.
Yes.
Okay.
I'm one of
it's-
those people where, like, you mentioned a show and
Uh-huh.
I'm too cool that I've never watched a certain,
Yeah.
I don't watch movies.
Uh,
I don't watch TV.
I think you would like it. It's about an ER in Pittsburgh.
Okay.
And it's kind of like real time. So it's 15 episodes and it's 15 hours in one day.
Jeez.
And I have learned so much from watching that show, actually. And part of the reason I started watching it was like I would see, various doctors, nurses, and things like that talking. They're like, "Holy crap, this is so realistic." It's not like ER or
Right.
Grey's Anatomy, which
right.
So it's
yeah.
doctor approved.
yeah, it is doctor
Yeah.
approved. Yeah, and they use all the lingo.
They do.
And one of the things that I am obsessed with is how the doctors present themselves to patients and the way that they communicate with them, because you get to see the whole thing. You know, they're in there with the people and everything. And then you also get to see them interacting with their colleagues and having their own personal life. And, there's somebody gets attacked or there's this problem and they're going room to room to room. And every single time, like one of the chief skills that they have is getting so honed in on that situation. And you get to see people do it really well and you get to see people do it really poorly. That's changed the way that
It's
I
almost
practice.
like and scene.
Yes.
Going
Yes.
into this room
Pretty
and I'm
much.
gonna
Absolutely.
Pretty much.
I used to think
Yeah.
about that in practice when back in like the we weren't around the Mercedes 80s, but like the tail end,
Yeah.
like the early 2000s, when we were still really, really busy
Yeah.
with like a lot of patients. I would think like, okay, I'm going in here. This is what I'm going to do. This is how I'm going to, and go.
Right.
Yeah.
And then I would go in. This being the VA's had it's a teaching hospital. So you would have younger docs coming in, like hospitalists when they're admitted, and osteopaths who are trying to learn the MD side of things.
Okay.
And they're getting their residency, so you'd see residents and stuff. And it was always hilarious to see the different personas they try to put on.
Yeah.
Yeah.
Because they think they need to do that to be the doctor.
Yeah.
Well, Mr. Maybe.
Mr. May, this is Dr. Jones. How are you doing today?
Yeah.
You don't have to do the authoritarian. Like,
Yeah.
I know that you look 14, but
Yeah.
I also know that you're the doctor. You don't have to do
Chill.
the thing. You don't have to
Listen,
be hardcore. Just talk
Doogie.
to me.
Yeah.
Oh, okay, sir. Yeah. All right. Okay.
Yeah, it's and I think it kind of is a double-edged sword with chiropractic, because I think people who pay a lot of attention to that and they're trying very hard to be very professional, I think that they get mocked a lot. Especially if you're trying to project
Internally.
that. Yeah. Well, I think even if you're trying to project that like on social media, for example, you'll see a chiropractor and maybe he's got on his white coat, wears a white coat when he practices. There's no problem with that. And they put on the white coat to do a video. And people are like, what are you wearing a white coat for? Blah, blah, blah. And my thing is like, he's wearing a white coat for the same reason that a medical doctor doing a video has their stethoscope on while they're doing
Yes.
it. It's not because they're going to listen to the heartbeat of everybody like watching the video. It's they're trying to project that image.
Yeah.
Which, is that the right thing to do? Yes. Yes, it is the right thing to do.
The
Right?
code is a symbol, and white
Absolutely.
has got symbolism too: purity, honesty, straightforwardness.
Yeah.
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 it's-
But
like,
some people, all they see
don't
is
ever put it to modern chiropractors to understand any bit of symbolism about anything.
yeah.
It's all very practical.
Yeah. And but then even outside of chiropractic, people are like, that person's trying to be a doctor.
Mm.
And it's like, and so they mock it. And so it's difficult, because I just want to tell chiropractors, do not get beat down by people who are mocking you trying to be professional.
Right.
Always
Yeah, never
just
that.
try and be
yeah,
professional.
never that angle. Mock
Yes.
the ones that are like trying to unprofessionalize.
Yes.
themselves.
right.
Yes.
That's
Who
right.
are making softcore porn trying to
Yeah,
adjust people.
Those, those
Okay.
Yeah. You need to watch
We
some of these
went there.
videos, Kathy.
Okay.
videos, yeah,
Yeah. And
videos are bad.
yeah, and like or there's this one horrible video of a chiropractor. He's in Africa and he's walking down the road and there's all these little African children. They're like, oh, hey, and I'm sure they're like, I don't know what they're saying. They're speaking African. I don't speak African for some reason.
Is
Uh,
African even a
Yeah, it's
language?
Africanese, I think. Yeah. But they're like running along and he's walking. And as he's walking, he'll like just go up to a kid and freaking adjust his neck.
Oh,
Like, and
no.
they're like, oh my gosh, like what? And
feel
so,
so much
and then
better.
How
all
do you
the
say
other kids.
consent in
Yeah.
Africanese?
Yeah, right. Exactly. So he's going along and he's just adjusting these kids. And I'm sure that he's just having this wonderful, amazing time just bestowing innate intelligence upon all these savages, and
Oh,
it's just
yeah,
like,
yeah,
and it's
yeah.
just like, whoa, dude.
God
And
complex much?
yeah,
Mhm.
absolutely. And so that is, I think, the other end of that spectrum where it's like you have to become comfortable projecting that persona, being professional despite mockery. And it's not just chiropractors though, because people don't want to talk about it, but medical doctors face that too.
Sure.
There is tremendous distrust
Mhm.
of medical doctors, which is unwarranted, and people mock them trying to be professional. And I think it's so hard to be a healthcare provider right now
Yes.
because of what you mentioned earlier, that freaking chatbot.
Mhm.
Yeah.
Yeah.
Yeah. Totally. Another one I think has a tremendous amount of challenges. PTs, the modern PT profession, like the PT I saw in the VA, so much compulsion to not touch the patient.
Yeah.
And I don't know how you guys pull that off. Well, I do know how, but the amount of this skill, the trust building skill and professionalism skill to be able to use basically only verbal cues
Mhm.
to get a patient to do anything at all without any touch input
Mhm.
or even therapeutic touch at all is pretty impressive. But it's also like, how can you tie one hand behind your back like that?
Right.
Is that a thing, Kathy?
It is a thing.
Really?
That's the big fight in our profession is manual therapy over exercise. Which one is better? Just like which is better, cardio or strength training?
Yeah, we should do a show
We should
about
do a
that.
show about
Yeah.
And
It's our
so
last
there's a
episode.
really strong, it's like to the political divide. Like manual therapy is just placebo. It's not going to do any good. So you should just make the person exercise. And then obviously there's the manual therapists. Like you can't do exercise unless they have mobility and so on and so forth. So yeah, that is a big fight within our profession. And of course, neither side, it takes a good blend of both.
Yeah. I would say maybe manual therapy with an attempt to be therapeutic you can have your objective questions about it,
Yes.
but touching people to build clinical competency and trust within the patient.
100%.
Because the therapists I experienced and some therapists believe in actually not touching the patient at all.
Yeah.
And if I wasn't touched during my journey,
Mm-hmm.
like if some nurse didn't come up and be like, you're going to be okay,
Mm-hmm.
and it's good to see you here. You're doing good.
Mm-hmm.
I think there would have been some issues.
Sure.
Yeah.
Yeah.
I'm not saying I would have quit, but I would
Right.
Sure.
Man, no one really gives a darn about me here.
Mhm.
Yeah.
Mm-hmm.
Healthcare is intimate,
Yeah.
which is tricky because you also need boundaries.
You need to be like a basketball referee. You need to be on the court
Yes.
and part of the game, but not part of the game whatsoever.
Yes.
Yeah. It's a good point.
You don't inject yourself into their
Mhm.
game, but you make sure the game goes smoothly and
Mhm.
it's played within the respect
Right.
and honor of the game.
Yeah.
And then everybody can have some fun,
Yeah.
except for the losing team. They're not going to have any fun.
Nobody has fun losing. I know that.
They learn
Ah.
lessons.
Yeah. This is so profound. I think that this is so good for providers to listen to.
Mhm.
I know I'm getting a lot out of it. I think it's good for patients to listen to also. I think hopefully it helps them to have a little more grace for who's on the other side of that equation. Hopefully it allows them also to have a little more courage in terms of what they're capable of, what they can be doing, what they should be
Yeah.
doing.
Yeah. I do want to put that as an asterisk. Like, patients, if you're listening, your doctor, your provider, even if they seem incompetent, like they're fumbling their words,
Mhm.
or they've got a little coffee stain on their shirt,
Mhm.
they're actually most likely probably quite competent.
Mhm.
Mhm.
They're actually probably quite good at what they're doing. There's
Yeah.
going to be a percentage that are just
Sure.
horrible
Yeah.
Yeah.
and they're bad, and they might even be illegal or whatever.
Right.
Yeah.
Whatever.
Yeah.
Give the provider some grace and be a good patient.
Mm-hmm.
Show up, go through the plan that they've outlined for you, and then ask yourself what you got at the end. Did you get
Mhm.
what you wanted? It's called the Dan Sullivan question. And I ask some young chiropractors to do this with a new patient when they meet them. What do you want out of this? If we do the plan, as I have outlined here, what do you expect the result to be? How would you like this to look at the end? And if the patient's like, I want to fly on a unicorn to Mars, you're like, okay, well, that's not realistic.
Yeah.
You need to come to Body of Health Chiropractic and Wellness Center in Corvallis, Oregon. Yeah, no.
So then you get an opportunity to manage expectations, right?
Yeah.
Yes.
And then your provider will not be able to sell you a line of fluff.
Yes.
And you can tell them exactly what they want. And as the provider, you can write down, this is exactly what they want. I better be honest. Can I deliver it or not? And then that's where that goes there.
I think that's one of my favorite questions that I ask in an intake is I ask people, what does a good outcome look like?
Yeah.
And it's surprising how many people haven't even thought about that coming in.
Like, oh, good question.
Yeah. And for some of them, because you can tell, like I do, like start back, right? So I know that's a person I'm not going to want to dwell on pain. Or, when you look at their intake and it's just pain,
Sure.
right? I know that's somebody I'm not going to talk about a lot of pain with. So sometimes I have to phrase it, I know that you want less pain. Outside of that, what does a good outcome look like? And I think that is a great question, getting people on the same team, because you can manage expectations. And also a weird thing about healthcare is that most people who have a good expectation out of their healthcare experience are going to have a good experience.
Yeah.
Yes.
Yeah.
So it's, that's a winner.
So much easier to be an oncologist. What do you hope to get out of this?
Yeah.
Not die?
Not
5 years.
Low bar.
Yeah, it's when you respond with, what do you see yourself doing in 5 years?
Not dead.
Well, Bobby, we have a tradition where we like to play a game with
We doing like the hot round or something?
We're going to do something actually pretty similar.
Okay.
I have developed a game here called Good Doc, Bad Doc. And I'm going to put you up against the PT.
Uh-oh.
All right.
Okay.
Now, and this one's actually going to be kind of fun. All right. I am going to read a complaint from a patient, right?
Okay.
And then I'm just going to randomly
like a board
say
complaint or a
like
physical complaint?
a physical complaint,
Okay.
right? And then I'm going to pick one, good doc or bad doc.
Okay.
And then you just chime in and you let me know, what does a good doc say? What does a bad doc say? We can have a little fun with this too, okay? Because games are fun.
Yes.
All right? You ready? Complaint number 1. This is the desk jockey disaster. I've been working at home, from home at my, let me start over. I've been working from home at my kitchen table for 2 years. My neck and upper back are on fire by 3 p.m. My solution so far has been more coffee and occasional profanity. Bad doc. What does bad doc say?
Wait, whose turn is it?
I just jump in.
Let's take some x-rays before we ask any other questions.
Try some Red Bull.
There we go. Switch out that coffee for Red Bull. Okay. Complaint number 2, the weekend warrior wreck. I play pickup basketball once a week, pull my calf or tweak my low back every other game, and my current treatment plan is an ice pack, Advil, and I swear I'll start stretching someday. What does good doc say?
Tell me what else you do in your life.
That's it. No, that's good.
Just start the conversation.
Yeah. What does good doc say to that?
Yeah, what does good doc say to that guy?
Good doc says, how's that working out for you?
Yeah. I like that. Very good. Yeah.
What's the problem here?
Yeah.
What? I don't see a problem. Oh, wait, that's bad doc.
You don't like
doc.
Advil? You got the generic stuff? Okay, very good. Complaint number 3, the phone neck fiasco. My neck and between the shoulder blades area ache every night because I scroll my phone in bed until midnight, and I'm convinced the real issue is that I just need to be cracked. What does bad doc say?
I agree.
Shishing!
Let's check your insurance first, but I agree.
Yeah, good PT says, I got this friend. He's a chiropractor.
Yeah.
Let's send you over there.
Good doc says, I don't think that's your problem. What's missing in your life?
I like that.
That's good.
And then does the patient just look at you like you're weird? What's
Yeah,
missing?
they do.
What's missing in my
Yeah.
life? What?
You might not. Yeah, you might
Uh-huh.
want to not start that with your first.
Yeah.
your first.
Is this existential?
Just crack me. I just came for the crack. All right. How about this? The car commute crunch. I drive 45 minutes each way to work. My low back and hips are start burning halfway there. And I've tried fixing it by shifting around the seat and turning the heated seats onto lava. What does good doc say?
What do you like to do for exercise?
What? Yeah. What do you do when you get out of the car?
Yeah.
Oh, yeah. Good. Why don't you quit your job? No.
Right.
How much?
Move closer.
Yeah.
Yeah. Mhm.
Move closer.
Yeah, because a 45-minute drive, I mean, you can't really suggest, hey, why don't you ride your bike? Unless you're in LA, because then you're
Yes.
probably 2 miles
Yeah,
away.
probably.
Right?
Yeah.
Just take the bus.
Yeah, is there
all right.
public transportation?
Last one. The gym hero hamstring. I sit all day and twice a week. I go straight into heavy squats and deadlifts cold. My hamstrings are like guitar strings, and I keep blaming it on being almost 40 now. What does bad doc say?
Sounds like you're getting old.
We
We have some supplements for you.
You have the hamstrings of a 90-year-old.
Yeah, that's it. You're deteriorating at
Yeah.
this moment. I can tell.
It's called degenerative hamstring syndrome.
Yeah. I don't know. What is your bad doctor?
DHG.
Oh, you just make up an acronym. I love it.
You're the
Degenerative
fifth good
hamstring.
doc, bad doc patient I've had today with a repetitive postural syndrome.
Yeah, exactly. Yeah. You know what you need? You need magnesium.
Mhm. I've got some in my lobby.
That's right. Not just any magnesium. You need colloidal magnesium.
Depends. What did
I'm the only person who sells it.
What did your AI chatbot tell you?
Yeah, that's right.
You know what I love to do is like whenever I'm getting through with the exam and putting everything in the computer and people are like, what are you doing? I was like, I'm asking ChatGPT. What's
wrong with you?
What's the next thing to do here? So
That's sad. We only have like 4 things to diagnose.
Yeah.
right? And that's the crazy thing. But this has been really, really eye-opening. I think we're on our 2nd year of this podcast.
Yeah.
And you are definitely the top guest of the 2nd year.
Yeah.
You're
Great,
also,
that's
you're,
cool.
You're also the
Not
first
that I've
guest
never
of the
heard
2nd
that.
year.
Yeah, I'm the first. Right? Not that I've never heard that, and they always put me up first to like set the precedent for everyone else.
Exactly.
This podcast just keeps getting better and better.
You know, I really feel like everybody else is screwed.
Yeah,
I
pretty
really
much.
feel like that. Yeah, this was some good information, and I really, really hope, and I suspect this is my takeaway. We're starting
Okay.
takeaways. I hope, and I suspect that one day, maybe not like this week, but maybe one day, somebody is going to listen to your story and what you shared, and it's going to have a huge impact on their life. Right? They're going to need what you said for their own personal struggle, maybe on the patient side, maybe on the provider side. But I hope, and that's part of the reason we wanted to have you on, is to amplify this message.
Yeah.
Because it can do so much for so many people. Cancer touches everybody's life if you just stick around long enough. You know, I lost my mom to it. We've lost friends to it. And there's so much good about what you shared. I'm sorry that you had to experience this, but
It's been a gift.
Yeah, but
Actually, it's been a gift.
I'm so grateful for that gift that you're giving to other people.
Because I get this concept you're talking about.
And you get this conversation.
Yeah.
Right. And so real blessing to have you. I'm so glad that you're well, my friend. So
Thank you. It's my takeaway too. You know, I do a podcast that no one listens to as well. But I know, but
we should set up a chat bot that
Yeah.
makes them listen to each other.
Yeah.
you guys will hear this eventually at some point. You'll hear we listen, we think it's great,
Yeah.
or that guest was great, or whatever.
Mhm.
Someday you're going to get a message from someone that says, I would have quit
Mhm.
if it wasn't for what you're saying.
Right.
You might get messages like I've got from the FTCA and what we've done there, where people said, I would have killed myself. I was going there if that group didn't exist.
Wow.
Mhm.
Some of these things we do, like FTCA,
Yeah.
my podcast, no one's buying a boat.
Yeah.
Right.
No one's making a
What?
career out of it.
No.
Darn it.
But like you said, I know somebody is going to hear at some point, and
Mhm.
it's more fun for me to be in this position. And I don't care if there's anything to gain from it for me personally, but someone's going to hear something that's going to move them along, and that's That's what it is. I mean, that's my takeaway. I do this because I feel like we're humans
Yeah.
Mhm.
and we should have human moments, not clinician moments.
Yes.
Right.
And people aren't alone. Even when you feel really, really lonely,
Yeah.
you just got to know that there's people out there that are there for you. So
People would have been sad if I died, and that's pretty
Yes.
cool.
That's good to know.
You know, hey, all
People
right,
kind of
all right.
like you.
Kathy, what do you got?
One, advocate for yourself.
Yeah.
Right. I mean, that's what
absolutely.
you did
Absolutely.
early on. You didn't just take, the
Through
first
the whole journey.
Yes.
Still.
Still advocating.
Yes.
Yes. Trust our health system. We do have we're very well educated. Our doctors are competent, but at the same time, trust but verify, right?
That's right.
Yeah. And give each other grace. Give yourself grace. I feel like I heard that from you. Is that I maybe learned to give myself grace through this.
Yeah, there was that celebrity because I don't watch TV.
Mhm.
The one that was on, he recently passed away. Very young.
Chuck Norris?
Nope.
No.
Not like Schitt's Creek. That's the name of the show.
It
I didn't
is.
say a
It's-
bad
that's-
word.
no,
One of those
we're
younger
still
guys.
PG.
And then, as he was dying, they were like, "What'd you learn?"
Oh, yeah.
Dawson's Creek.
Yes, Dawson's Creek. Yeah,
not Schitt's
yeah.
Creek, Dawson's Creek.
It was Vanderbeek.
James
James
Van Der
Vanderbeek.
Beek. Yeah.
And it was.
Is that how you say it? Yeah.
And I'm going to get it wrong. Other
Yeah.
people can look it up, but he said, what I learned is that I'm okay and I can love myself.
Yes.
Mm.
The real, I'm perfect the way I am, even if I'm dying.
Mm-hmm.
It's beautiful.
Mm.
Yes.
And when I read that he had said that, I'm like, oh,
Yes.
Yeah. All the
but
feels.
only because I had come to that conclusion on my own.
Yes.
Nothing's on your own. Something happened where I was like, somewhere in my journey,
Mm-hmm.
I learned grace and I'm worth loving or being sad about this or
Right.
whatever. And
Right.
it worked.
Yeah.
And it's an amazing thing. I remember having this thought when my mom was dying from cancer, and it was a thought that you can have cancer, you can have terminal cancer, and you can be healthy,
Mm.
Yeah.
right? So you can not have, like, your body can be failing you, but you can be a healthy person. You can be whole, and that's just such a weird thought to me. You don't have to have all the parts working for you to be a healthy person.
Yeah.
So
Mhm.
You can also die a normal, healthy death.
Yeah.
Whatever you want to call that. The
Sure.
longevity.
Uh-huh.
And be completely sick on the inside.
Facts.
Not
Facts.
get there.
Right.
Yeah,
Mic drop.
totally.
So my goal is that everyone gets there.
Mm-hmm.
Yeah.
Yeah. Just everybody get healthy.
Mhm.
So, well, I think there's one more thing that we got to add,
Mhm.
Kathy.
Yep.
That's that. There's no I in pitch.
Ah.